Right, so if you have read and understood considering the history taking station, kindly begin.
Hello, I'm Washan Mahan. Hello, I'm Dr. Dapper, one of the surgical doctor. Can you confirm your name and date of birth, please?
Okay, hi. I'm Victoria. I'm 53-year-old.
Nice to meet you.
Nice to meet you too, doctor.
How can I help you today?
Oh, doctor, I actually came because I have a very bad headache.
Oh, I'm sorry to hear that. Can you tell me more about it?
Oh, the headache actually happened last night. It was so bad I actually wasn't aware of my surroundings after. And then so I woke up this morning, but then the headache is still. And this is the second time the headache is happening. It's so bad. I don't know what to do, doctor. Can you help me?
Okay, sorry to hear that. I will help you. Just I want to ask you some questions if you don't mind.
It's okay.
So where it's the start? In the back of your head or in the front?
Okay, actually it starts on the front.
What in the front? When it's go?
Well, since it started yesterday, it's not gone. It's still there.
Yeah, so it's localized. So can you prescribe it is dull pain or heaviness or thumping pain or stabbing pain?
This pain is so bad. It's the worst pain I've ever experienced in my life.
Okay, I can imagine how it's bad. So anything aggravate that?
You said?
Anything do which you would do that make the pain more?
Oh yes. If I strain myself, maybe I walk or do any severe activities, it gets worse.
What do you do to decrease this pain?
Nothing actually works. Nothing.
Oh, okay. That does it is the special time on day? It's more, or it is progressive all day?
It's always there. It's just there.
Okay, it is continuous or coming and go.
It's continuous.
Does it's associated with the throw up?
Yes, yeah. Last night when it started and it was bad, I lost consciousness and then I think I dropped.
Yeah. So does it associated with the neck stiffness?
No.
Any fever? Any increase in the temperature?
No, none of those.
Do you have any history of the bending or head trauma?
No.
Do you have any change in the vision?
No.
Do you have any change in the sensation?
No.
Do you have any? Do you feel any weakness in your limb?
No weakness.
Yeah. Okay. Do you have a good appetite or your appetite decrease?
Well, I've not been able to eat since this
Okay.
had started. Yes.
Do you have any decrease in the body weight
No.
recently?
No weight loss.
So how it's affect your life?
I really can't do anything now. I just want this pain to go away.
Do you feel it is sensitive to the light?
No, not at all.
Okay. Do you have? You told me you have another episode. What it's occur?
That was 2 years ago.
It is the same or it's different?
It's different. That was a bit milder.
Can you tell me more about it? Yeah. Can you tell me more about?
I had a transient visual problem. I couldn't see well, and then had a headache. But after that, everything just disappeared. But this time it's bad.
Okay. Do you have any medical illness?
Well, I have no really. Well, I don't have any medical illness really.
Do you have any past surgical?
I have
Okay,
yes.
so
My doctor, my GP manages me for polycystic kidney disease.
Okay, I'm sorry to hear that. Yes, I can imagine. So, do you have any surgery before?
No, no surgery.
Do you have? Do you take alcohol?
No, I don't take alcohol.
Are you smoking?
Yeah, occasionally.
How much per day?
Maybe once or twice a week.
Okay.
Occasionally.
Any medication?
No meds. Meds.
No medication. Okay. Any allergy?
No allergies.
Do you take any drugs over counter or substance?
No, none of this.
Any family history?
Yeah, my aunt, she died of a brain problem. She bled into her brain.
Accept my condolences. Any traveling history recently?
No, I've not traveled anywhere.
What do you do? What do you do for a living?
Well, I'm a type. I used to be a typist.
Okay.
Okay.
Can you present your case now?
So, yeah, 53 years old,
Yes.
female, presented with the severe 2 episode of headache. The last one today. It started today in the frontal sign. It's progressive, associated with the loss of conscious, through vomiting, and also aggravated by the straining and walking. Staying and walking. She's not drink alcohol. She's not
It's
drink
not
alcohol.
significant. Not significant. Okay.
Yes.
You should
She
say
has family history.
and
She had
is
family
being
history.
treated for polycystic kidney disease.
Yeah.
These are the significant. Okay.
Yeah.
Can you please tell me what are the differential diagnoses that you will consider for her?
So with this history, with the family history, so it is maybe perianeurysm, rupture of perianeurysm, and subarachnoid hemorrhage.
Okay. What else would you consider? Because differential diagnosis.
So the differential diagnosis, maybe it is infection, encephalitis, meningitis,
Yes.
and it could be stroke. Yeah, it could be malignancy.
Could be even tumor, brain tumor. Okay. How do you plan to manage this patient?
So according to ABC, ATLS, so
Yes.
I started with the assessment airway and breathing and management and circulation. After that, I will discuss this, consult with the neurological department, and also discuss in the multidisciplinary team, and we will arrange for the blood investigation and the CT scan, and the lumbar puncture is made be okay if the patient coma and
can you please tell me what are the treatment?
Yes,
what are the treatment options that you can offer this patient?
So it is either coiling, treat the aneurysm by the coiling, and also by the craniotomy or barrel hole.
These are the surgical management or the invasive management.
Yes, and also you can non-surgical by giving the nifedipine and admission to the intensive care unit, observe intracranial pressure, and nifedipine and the laxative such as the mannitol.
Yes, but then you'll discuss it with the MDT team, and then you'll send the neurosurgical unit, maybe request. All right, good. Thank you.
Thank you.
Right, it was definitely well improved, quite very much improved from.
Thank you very much.
Days. One can tell. Maybe I should give Dr. Abbas a chance to give feedback first, but I'm highly impressed. Yes, please, Dr. Abbas, would you want to give feedback first?
Okay, ma'am. Well, ma'am, I think he covered almost everything.
Yes.
Yes.
Anything that he missed?
No, I don't think. Well, I don't think there's really much you missed, but you didn't talk about ice. You didn't ask for my.
Yeah, and he didn't even tell me at the end that if time would have allowed to. Then he would have asked those. Okay, small things that he missed, very small. When he was asking about the headache, he could have asked if it is associated with any seizure or blackouts. And
Yes, ma'am.
if he could
Yeah.
grade
This
the
is-
severity of headache, between 1 to 10.
Yeah.
This is
Yes.
from my side. I think it was
Yeah.
good enough if he would have mentioned, because otherwise he covered
Yeah.
fever, he covered yes, many things. And then
Yes, ma'am.
I
Ma'am, I also wanted to ask. No, at the point I wanted him. I told him the headache is very severe, and I think he should. I need a. If there's anything he could do to help me, because I am not comfortable. So he just told me,
Yes.
I'm sorry. I'll just ask you a few questions, and hopefully something will be done soon about it.
yeah,
So
he could
I
have
think he
asked
could have
you
offered me an
painkiller.
analgesic.
Yes, yes,
Yes.
yes.
At that point, yes.
Yes,
Here,
it is so important.
patient,
Great,
yes,
thanks for this information. Yeah.
yes. Here
Yeah,
you
I
could have
appreciate
taken a
the.
pause and you could have offered, okay, can I arrange, yes, painkillers for you? And then you could have, if patient say, no, that's all right, I'll manage, then you can continue. But in exam, if it comes, do it like this. Very good. Good.
Thank
But
you.
Thank you
then
very much.
compared to, yes, one can tell that he wasn't repeating himself. He was taking his time to ask new questions. So progress was happening. Small things, everyone misses. He'll do better tomorrow, definitely.
Thank you very much. I will.